Welcome to Biological Beginnings and Prenatal Development and Birth. Here you can see we have different types of twins. We have fraternal twins, which are boy and a boy, girl and a girl, boy and a girl. There's basically no genetic similarities other than any other sibling match that would be out there. They just happen to share the same birthday. And then you have your identical twins. So they're going to have the genetic makeup identical to one another. So either two girls or two boys. And then you have your what we call conjoined twins here. And so these are twins that don't separate. The egg doesn't split completely. So we sometimes are able to separate, sometimes not. It just depends on how they're connected. You can see the three pictures here. There would not be a way to separate them. There was a set of conjoined twins that were born a few years ago down in Texas, and they were connected in the abdomen area. And they were able to successfully separate about a year or so after birth. They did the surgery and were successful at that. Charles Darwin is probably the name you're familiar with here. Charles Darwin has the natural selection or survival of the fittest is the term that we kind of coined from his theory, but basically believes that the best of the species is what's going to survive from one generation or one time period to the next. And then we have David Buss, who also looked at how things evolve and change over time, just as Darwin studies evolution over a period of time. But David Buss was interested in studying aggression and how our levels of aggression have changed over time. So, do you think we're more aggressive as a society today or less aggressive than we were hundreds of years ago? And, the answer to that question is we show aggression in different ways today than we used to. We're not as physically aggressive, we're not fighting for land and basic survival needs anymore, but we are much more passive aggressive than we used to be. And then we have, the aggression that we show on social media. And so the ways in which we show aggression has definitely changed and evolved over time. So in reproduction, the genetic process here, mitosis involves one cell division. It results in two daughter cells, a diploid daughter cell, so the chromosome number remains the same as a parent cell. Daughter cells are genetically identical, occurs in all organisms except viruses, creates all body cells, somatic apart from the germ cells, eggs and sperm. The prophase is much shorter. In the metaphase, individual chromosomes line up along the equator. And during the anaphase, the sister chromatids are separated to opposite poles. With meiosis, it involves two successive cell divisions, results in 4 daughter cells, results in haploid daughter cells. The chromosome number is halved from the parent cell. Daughter cells are genetically different. Occurs only in animals, plants, and fungi. Creates germ cells, eggs and sperm only. Prophase 1 takes much longer. In the metaphase 1, pairs of chromosomes line up again along the equator. During the anaphase, the sister chromatids move together to the same pole. And during anaphase 2, they are separated to opposite poles. So after this mitosis and meiosis process, fertilization happens, and the egg and the sperm fuse together to create the zygote. So 23 chromosomes from the mother and 23 from the father. Genotype is what's known as the person's genetic makeup. So if you analyze the DNA and the different traits and characteristics that came through that DNA, and then the phenotype is the observable characteristics. So, being able to see their eye color and their hair color and hey, your mom has blonde hair and you have blonde hair, so you got your hair from your mom, or your dad has brown eyes and you have brown eyes, so you got your eyes from your dad. So anything that's observable characteristics like that, height, weight, would also be part of that. There's many chromosomal abnormalities that can happen during the conception and birthing process. Klinefelter syndrome is one that is specific to males. And so when the male has this extra chromosome, they tend to have female characteristics or traits. So a man that has Klinefelter syndrome would have wider hips, small breast development, smaller testicles. They tend to be very large, very tall in stature, not like 6 feet tall, but closer to 7 feet type tall. And so they're not able to reproduce. So there's no sperm, there's no reproduction that goes on. With Turner syndrome, that's specific to females. And so, I'm sorry, I should have said this. Klinefelter syndrome, when you have a boy, you have an X and a Y, and that's how you end up with a male. With Klinefelter syndrome, you have an extra X, so it's XXY. And that extra X is what gives us these female type characteristics and look to the male body. Turner syndrome, so when you have a girl, you have an X and an X. With Turner syndrome, you're missing an X on a chromosome. And so when you miss an X, it gives you that more masculine type look. And so women that have Turner syndrome tend to look more male. So their facial features tend to be more masculine. They sometimes get extra hair growth where women normally don't grow hair. They have small breasts. They don't get a menstrual cycle. They tend to be shorter in stature than your average female. And they also have what is known as a webbed neck. And so if you search online, you'll see pictures of webbed necks, but it's thick. It's kind of like an extra skin fold that comes off of the neck. So it's a little bit, I think, more obvious if you search, Turner syndrome and look at pictures versus Klinefelter syndrome and look at pictures. I think it's a little bit more obvious to pick out somebody with Turner syndrome. Tourette syndrome is tics. So sometimes they're controllable, sometimes not. But it's, people often just kind of speak out. Sometimes it's appropriate, sometimes it's not. But there's not always control that they have over what comes out. Sometimes there's like a head jerk or, some kind of weird body movement or abnormal body movement that's associated with it. But generally speaking, it's out of their control. And, hopefully over time they can learn to manage it better, but it takes time. So the germinal period is the first 2 weeks after conception. So when the egg and the sperm fuse together to create that zygote, that's what we do. That's what's going on the first 2 weeks. About 10 days or so after conception, that is when it will attach to the uterine wall, and then the pregnancy will continue from that. But that takes about 10 days. Once we hit the embryonic period, that's from week 2 to week 8. So for, about the next 2 months of development, that's where all of your major organs and systems and everything are in place. So developing still obviously throughout the rest of the pregnancy, but everything is up and functioning and working, and yes. And then when we get to the fetal period, 2 months to the final 7 months, so the remainder of the pregnancy, everything will continue to develop so that once the baby is born, it can withstand being on its own and separated from the mother. So pregnancy is 40 weeks, which is really 10 months. So 38 weeks is considered full term though. And if you are born anything under 5 pounds is considered premature. So the age of viability right now is about 23 weeks. If you can get to the 23 week mark, then there's I believe it's a 30% chance of survival if you can get that far into the pregnancy. This is just to kind of give you a snapshot of what happens during each trimester of the pregnancy. So this is over the first 3 months of the pregnancy. So you can see the differences that happens at each month as we move along. The heartbeat being detectable at 8 weeks, there's a heartbeat prior to 8 weeks, but because of our technology and we're not able to generally hear it prior to the 8-week mark. But you can see by the end of the 12 weeks, it's about 3 inches on average. So small, but growing. But remember, by this point, all of those nervous system, respiratory system, heart, lungs, everything is there and operating, just not to its fullest, form yet. Our second trimester, 16 weeks through 24 weeks, takes us through the next set. So you can see we've grown a little bit since our 12-week mark. And we're about, by the time we finish this 24-week mark, we're about the size of a ruler in terms of length. You generally find out the sex around the 20th week. There's a lot more movement. Generally, sometime between week 16 and 20 is usually when you start feeling it. But there's quite a bit of growth here as well that's gone on, right? And so that's why as the baby gets bigger, you're going to feel it more move throughout the uterus. And this is just a snapshot of our third trimester. And so with the third trimester, like I said earlier, the 38 weeks is considered full term. 40 weeks, generally speaking, we don't get much past 42 weeks, and then the baby has to be delivered, so they'll induce labor if it gets to be too long. They do tend to have like a sleep-wake cycle that starts around this time, although they're generally more active at night and sleeping more during the day. But that's also the oxygen that they get from the mother. When the mother is up and moving around, the baby gets less oxygen. When mom settles down at night and relaxes, the baby gets more oxygen and tends to move a little bit more, so a little bit more activity. And then the last few weeks here of the pregnancy, there's a lot of immunities that the baby gets from the mother. And so that helps them to stay healthy and not get sick when they are introduced into our world full of germs. So I want to draw your attention to this bottom left side that says 1/3 each. Approximately 1/3 of infertility is attributed to the female and 1/3 to the partner, and then 1/3 of the problem could be explained by either or both. So it's not heavily one-sided as we see more problems with women or more problems with men, but it's pretty evenly distributed. If you look in the middle, the chances of conceiving, so this is a normal, healthy 29 to 33-year-old couple, only has the chance of conceiving about 20 to 25% in a given month. So the odds of conceiving for anybody that's not struggling, is already pretty low. So when you throw in, any kind of issues like the polycystic ovary syndrome or any kind of sperm production issues, that can definitely, cause more problems and increase stress levels for the couple that's trying to conceive. We've come a long way, though, with other alternatives to helping with conception other than the natural way. We have the in vitro process, which is where we take the egg from the woman and the sperm from the male, and we fuse them together in a petri dish and then implant it back into the woman. And then still, like I said earlier, it has to attach to the uterine wall within that 10-day marker, and that's how we know that the pregnancy will continue. So that we see more often today. Taking fertility drugs can increase the chances of conceiving the natural way if, that is the goal. But that also increases the chance that, you'll have multiple births as well if you're taking fertility drugs. Artificial insemination, people still do. If you search online for sperm banks, there are sperm banks where you can buy the sperm and have it shipped to your house and essentially do it from home. Same idea is kind of like a turkey baster. This sperm comes shipped on dry ice and you let the sperm thaw out and insert it, with something like a turkey baster type idea. But on these sperm bank sites, you can look at so many of the specifics to what the guy is or looks like, or qualities and characteristics about him. Sometimes there's audio recordings, but there's like a full medical history that's disclosed. Generally speaking, these to purchase sperm runs on average between $350 to maybe $550 per dose per ejaculation. It's about what it costs to purchase something like that. So that's an option. And then surrogacy would be another option. And then obviously adoption would be another option. So these are a list of drugs. We'll go through some of these on the next few slides. But really what it comes down to, it doesn't matter if it's prescription drugs or non-prescription drugs, they all run the risk of causing harm to the fetus if injected. And different drugs have different risks at different stages of the pregnancy. So you can see here, beginning the 3rd week until the 8th week, when all those organs are developing in like the respiratory system and circulatory system, drug use might cause problems. It might lead to miscarriage. It could cause birth defects. There's so many unknowns that, we can't say specifically what the drug is going to do at this time. Generally speaking, those first 2 weeks, the drugs or alcohol won't have an effect or destroy the fetus altogether, because oftentimes people don't know when they're pregnant. But we run more of a risk of these issues happening after the 3rd week. And then after the organs have completed their development, birth defects are unlikely, but we might see other issues in the organs and tissues being affected. Something like fetal alcohol syndrome, we tend to see brain development issues such as short-term memory loss or learning disabilities, that type of thing associated with it. This study that was done in Denmark, they drink 8 cups of coffee per day, which sounds like a lot. But if you think about, the Starbucks that you get or the Dunkin' Donuts that you get, you're not getting like a small, coffee, you're getting a large one. So how many cups are in your, large coffee that you're drinking? And so moms who consume 200 milligrams or more of caffeine a day had double the risk of miscarriage compared to those that didn't. They also saw an increase in stillbirths associated with too much caffeine. And so you got to remember, caffeine comes in, different pop. It comes in chocolate. It comes in, your energy drinks. So you're getting caffeine from different, sources throughout the day. So it does add up over time if you're consuming it often. So that's one thing that we want to avoid as well when pregnant is drinking caffeine, which we often don't think of as a drug, but it's the drug that we use the most in the world. These are some of the issues associated with alcohol, drinking alcohol throughout the pregnancy. Sometimes the deformities, not having a full arm that develops, or a full leg that develops. Poor coordination, so like gross motor skills, walking, running might be a little bit off as a result of alcohol. I mentioned earlier, like learning disabilities, we tend to see that in school. Short-term memory loss is very common with moms that drink during the pregnancy, but it's not illegal to not drink or to drink. So, that's unfortunately something that we can't, necessarily stop somebody from doing, because alcohol is considered legal. Same thing with, tobacco or nicotine. It's legal, so we can't stop them from consuming it during the pregnancy. You can see as we go, there's a lot of these that are similarities with the effects of these drugs. Premature delivery we see here, stillbirths are at an increase, being born too small, low birth weight, all are very common. Sometimes there's a heart defect. heart murmurs sometimes, holes in the heart that can be associated with nicotine as well. You can see the difference between the healthy baby on the left and the not so healthy baby on the right. So this can be a result of something like cocaine, crack, methamphetamine. They suppress the mother's appetite, so the mother doesn't eat as much, and therefore the baby's not getting as many nutrients. Like so many others, we see stillbirths, we see premature deliveries. The biggest problem here is the addiction that comes with it. And so when the baby's born addicted to these drugs. And so they're going to go through the same type of withdrawal symptoms that an adult or anybody would go through getting off the drugs, but they're an infant. They can't communicate other than crying. So it's very difficult for them to come into life like this, addicted to these types of drugs. And DCFS, Department of Children and Family Services, will get involved right away and take the kids, but they're often hard to place in foster care because, you're dealing with somebody that's addicted and getting off of a drug. And so the behaviors and the crying is sometimes just so much. It can be hard to place babies like this. Like so many others, we deal with the same issues here with the premature delivery and low birth weight and things like that. The biggest risk here, though, with heroin and other narcotics can be the HIV virus. And so if a mom is injecting herself with heroin, there's a chance that HIV is going to spread. And then there's a chance that it's going to spread to the baby as well. We've come a long term in our medical technology and development, and if a mother is HIV positive, it is possible to have a baby that is not HIV positive and to not pass it to the baby. But somebody that's on heroin isn't meeting with a doctor and, coming up with a plan and monitoring it to, reduce the risk. And so they run the chances of passing this to the virus to the baby. In early labor, your cervix opens to about 4 centimeters. You probably spend most of the time during these early stages at home. Try to keep relaxed and do things that will make you feel rested. Drink clear fluids, eat light meals if you want to, but just keep track of the contractions. Contractions may go away if you change activity, but over time they'll get stronger. When you notice a clear change in how frequent and how strong and how long the contractions are, and you can no longer talk during a contraction, then you're probably going into what we call as active labor, which we'll talk about on the next slide. During active labor, your cervix opens from 4 to 7 centimeters, and this is about the time that you should head to the hospital. When you have contractions every 3 to 4 minutes, and they each last about 60 seconds, it often means that your cervix is opening faster than 1 centimeter per hour. You may not want to talk as you become more involved in dealing with your contractions. As your labor progresses, your bag of water may break. This causes a gush of fluid. After this, the contractions tend to speed up. Slow, easy breathing is usually helpful at this time. Focusing on positive, relaxing images or music may also be helpful. Changing positions, massage, hot or cold compresses, walking, standing, or sitting upright can help. Relax as much as you can between contractions. It helps to save your energy. As we transition to the second stage, the cervix opens from 7 to 10. This is typically the hardest or most painful part of labor. It's when your cervix is open to its fullest. Contractions last 60 to 90 seconds and come every 2 to 3 minutes, so there's little time to rest. When you move to the second stage, This is when you're completely dilated, and the contractions help to push the baby down the birth canal. So there's intense pressure, similar to an urge to have a bowel movement that you may feel. The healthcare provider may ask you to push with each contraction. Contractions continue to be strong, but they may spread out a bit and give you time to rest. The length of the second stage depends on whether or not you've given birth before and how many times, the position and size of the baby. The intensity at the end of the first stage of labor will continue in this pushing phase. You may become irritable during the contraction and alternate between wanting to be touched and talked to and wanting to be left alone. It's not unusual for a woman to groan or grunt or moan when the contractions reach their peak. And the third stage of labor is the afterbirth. So even after you deliver the baby during this stage, you still have to deliver the placenta. So sometimes there's a few contractions left and you have to push the afterbirth out. Generally, this happens within 5 to 15 minutes after the baby is born. So the next few slides are not in the book, but just extra information that I thought was kind of interesting. Home birth is what we see here, and with the home birth, we don't see too many of these. They're not necessarily uncommon, but they're not as popular either. It's generally a midwife that would come to a home to help deliver. At least it's not common here in our part of the world. Natural childbirth is no medication, no anything. And then a medicated birth is what you see in this top picture, and the epidural is being given into the spine, and so that makes the person numb from the waist down. So a cesarean happens for a multitude of reasons. Sometimes there's emergency situations at the end, and it requires the baby to be delivered right away. There could be distress to the heart. Sometimes the birth canal, the babies do not fit down the birth canal. This could be, a woman that has smaller hips. It could be a large baby. So there's different reasons that can cause a cesarean. But generally, once they realize that the cesarean is needed and they have the mom prepped and ready to go, they can usually get the baby out in about 60 seconds. Water births, there's more hospitals that are making room for this and allowing this, for the babies to be born in a pool of water. It can be a much more relaxing and calming way for the baby to enter the world. Hypnobirthing, if you believe in hypnosis, that might help to ease the pain during the contractions and help those be a little bit more controlled. So this non-recumbent birthing positions, this is anything other than how we typically deliver at the doctor, which is laying on our backs, feet in the stirrups, but there's different positions that can sometimes be less stressful to the body and to the baby. Kneeling and or even standing can help. Gravity works better in your directions. One of the hardest ways for us to deliver is how we do on our backs with feet in stirrups. That is, puts its most pressure on us. It's convenient for the doctor, but it is, kind of working against gravity and the most difficult for us to try and deliver with. So sometimes you can find doctors that'll be willing to try different positions that might allow you to feel more comfortable and to experience the whole birthing process a little bit easier. Chiropractors, some people recommend this, can help to help your back during the pregnancy and make labor and delivery a little bit easier. Reflexology sometimes can help, especially during labor. The massages can help to manage the pain and make it not so intense. So these are a few other suggestions. So acupuncture or acupressure or different herbs or aromatherapy, again, these are just ways to try and manage the pain and discomfort that you feel during labor, just to try and minimize it as much as you can. Postpartum depression can happen to anybody. The birth of a baby can trigger a jumble of powerful emotions, from excitement to joy, fear, anxiety. but it can also result in depression. Most new moms experience some type of postpartum or baby blues after childbirth, which includes mood swings or crying spells, anxiety, trouble sleeping, but usually these go away within the first 2 to 3 days after delivery, sometimes lasting up to 2 weeks. But some moms experience a more severe, long-lasting form of depression known as postpartum. This is rarely an extreme mood disorder called postpartum psychosis can also develop after childbirth. Postpartum depression isn't a character flaw or a weakness. Sometimes it's simply a complication of giving birth. There are treatment and signs that you can watch for to help manage your feelings and be aware of them. Depressed mood or severe mood swings would be associated with this. Excessive crying, if you're having trouble bonding with the baby, if you're withdrawing from family and friends, loss of appetite, not sleeping, feeling overwhelmed or fatigued, reduced interest in things that you used to like to do, if you're more irritable and angry, having fear that you're not a good mother, feeling hopeless or worthless, not being able to concentrate or make decisions, feeling restless, severe anxiety and panic attacks, thoughts of harming yourself or your baby, or your current thoughts of death or suicide. If there's any kind of psychosis that's attributed with hallucinations, delusions, confusion and disorientation, obsessive thoughts about the baby, paranoia, attempting to harm yourself or the baby. So there's different levels of it, but that's why, it's important to support the mom during those, first few weeks so that she doesn't feel overwhelmed. This link here is a story of a mother that suffered from postpartum psychosis, and Andrea Yates is her name, and I'll let you watch the link, but she had 5 children and didn't really experience postpartum until I think it was the 4th child when she started to feel more depressed. And so she ended up drowning all 5 of her children in the bathtub due to having postpartum depression. So I'll let you take a look at the link. You hear the father talking, and you'll see clips of her with the children as well. And that will wrap up our Chapter 2 PowerPoint. So if you have any questions, feel free to reach out to me.